concept of gene therapy is interesting because a lot of people are aware that when you inject a viral vector into the eye, it can potentially cause inflammation, but it depends on the route of administration. So when you do an intravitreal injection, you can definitely cause a lot more inflammation than, let's say, if you did a subretinal injection. But suprachoroidal injection of AAV, I think, is somewhere in between. It doesn't cause as much inflammation as what we see at the same dose as intravitreal injection, but it may potentially cause a slightly different, milder form of inflammation as we've observed in preclinical animal studies, mainly because the suprachoroidal injections lead the vector to transduce more kind of the wall of the eye, the sclera, and that is technically outside the blood-retinal barrier. So when you transduce outside the blood-retinal barrier, you're more likely to trigger anti-drug antibodies or neutralizing antibodies against the vector and cause some inflammation. So typically, to manage inflammation for things like gene therapy, most ophthalmologists are using just regular slit lamp examination, careful monitoring for things like anterior chamber cell, vitreous haze. These are normal in the toolbox of uveitis patients, uveitis specialists, but often not as much in retina specialists. So I think it's important for us as a community among retina specialists to pay careful attention. Some of these cells are not what we typically call inflammatory cells, like white blood cells. They sometimes might be pigmented cells or just little pigment clumps, but it's still important for us as a community to understand what's going on and pay careful attention for the safety of our patients.